Thank you for joining Gowling WLG for this Employment, Labour and Equalities podcast. We are an international law firm working in major sectors including energy, life sciences, infrastructure, financial services, real estate and technology. Our episodes cover the latest developments relevant to you across different sectors and services. Make sure you subscribe to receive the latest episodes of this podcast. Visit our website gowlingwlg.com for all of our latest insights.
Hello and welcome to this latest in our series of podcasts looking at returning to the workplace post-COVID. I'm Anna Fletcher, I'm a legal director in our Employment, Labour and Equalities team here at Gowling WLG, and today I'm joined by Andrew Litchfield, a partner in our dispute resolution group, who is a well-known health and safety expert. Andrew is going to look at some of the issues facing employers as people start to return to the workplace, but also, of course, not forgetting those who've continued to remain working in the normal workplace during the course of the pandemic and the health and safety issues that might arise there. So, Andrew, what do you think employers should be thinking about now?
Hello, everybody. Hi, Anna. So the COVID risk, despite Freedom Day, the COVID risk has not gone away. It's still there, it's still out there, and it continues to evolve. So in some ways, it's possibly a little bit worse than it's been at the moment because those cases are continuing to rise just at the moment. But on the other hand, it's a lot better because of the vaccination program that the government has been going through. So the risk continues to evolve. Sitting behind all of it is the duty that an employer has, not a COVID specific duty, but the duty that an employer has to ensure, so far as reasonably practicable, that their employees and anyone else who's affected by what the employer does is not exposed to risk to their health and safety. And the way that they need to discharge that duty, COVID risk, exactly the same way as every other risk, is to conduct risk assessments, taking account of the latest position or the latest information about the risk, and then put in place control measures as a result of that risk assessment, which identifies the risk and then puts into place practical steps to eliminate, if not reduce as far as possible, the latest risks that arise from the condition.
I know over the last 16 months or so, we've had regular conversations about the guidance and it changes a lot. But what's the latest guidance saying that employers need to be focusing on, including risk assessments, obviously?
Yeah, so the government has this week or very recently, of course, stripped away all the previous guidance and replaced it with new guidance following Freedom Day. But nothing fundamentally has changed as a result of that guidance. As I said, it's still necessary for an employer to conduct a risk assessment, and the control measures that flow from that risk assessment remain exactly the same. The most important of which, I think, is that employees should know, or visitors should know, that they shouldn't attend any premises if they have symptoms or if they suspect that they've been in contact with somebody who has. The idea being, of course, that you keep the virus out of the workplace in the first place, and then following on from that are the practical steps which everyone's got used to make the premises COVID secure. So lots of cleaning, enhanced cleaning still has to be done. Ventilation is really important. There's a debate about face coverings, which is raging in the press and raging more generally, but an employer is free and able to consider face coverings as one of its control measures if necessary. And then I think most importantly, because there's a legal element to this as well as a sort of human element, it's really important to communicate with the employees and with the visitors about those control measures, make sure they understand what the workplace will be like when they visit, make sure they understand what they need to do when they're there, make sure contractors and visitors understand what they need to do when they're there, and make sure all that's clear so that those control measures are followed in practice and work effectively to minimise the risk.
We hear a lot about office ventilation, for example. Is there any specific guidance for employers insofar as ventilation is concerned?
The two key places to look in terms of guidance are the government guidance, which we've mentioned, but also the Health and Safety Executive issue its own separate guidance, which is good and accessible and practical and available on the HSE website. In terms of ventilation is now much more now than at the beginning of the pandemic recognised as a really important control measure. And the risk assessment should identify areas which are poorly ventilated, and the guidance encourages the use of carbon dioxide monitors to identify those poorly ventilated areas. And if ventilation can't be improved in those areas, then an employer should consider whether to eliminate the use of the area altogether or to restrict the numbers of people who have access to it or the time that they spend there. And of course, the use of outside space is encouraged if that's practicable and available and can be done as well.
Lots for the employer to be thinking about in terms of that assessment. So if we turn to some particular categories of employees, and obviously we've been advising clients on managing the communication piece and dealing with employment related issues, but in terms of people who are critically extremely vulnerable, now that sort of the shielding arrangements have been lifted, again, is there any guidance on how employers should be dealing with individuals who fall into that category?
All roads, regardless of the nature of the risk, all roads lead to the risk assessment. We've spoken about it a lot already. And the risk assessment in relation to COVID should consider the task that people are being asked to do, which includes how close they are to other people and whether they're facing them to the task. It should consider the area where they're doing the work. Is it a well ventilated area or not, as we've discussed? And finally, it needs to take into account the individual, the person or the people who are involved in the task. And the HSE guidance encourages employers to discuss returning to the workplace with anyone who's critically extremely vulnerable. Again, there's a big piece around communication to explain to that individual the measures that are in place in the workplace to see whether it's COVID secure or not, to discuss and have an open conversation with them about how that might work, bearing in mind their individual circumstances and what makes them critically extremely vulnerable. And the guidance and the advice is that an employer should take every possible step to enable a vulnerable person to work from home if it's not possible to or safe to come into the office in those circumstances. But if that's not possible, if it's not a task that can be done at home or a job that can be done at home, then employees can continue to use the coronavirus job retention scheme and furlough workers until the end of September 2021.
Thank you. So if we've returned to the workplace in perhaps more significant numbers, or for those employers where people have been attending the workplace, we've been hearing a lot about the rising number of cases of infection. What happens? What should an employer do if there's actually a COVID outbreak in the workplace?
It's of course very difficult to tell, isn't it, whether an outbreak is or whether an individual case is the result of a workplace exposure or something that's happening in the workplace, which means the risk is not properly managed. But if it looks like positive cases of COVID-19 are arising from the workplace, irrespective of the number, then the employer should inform the local authority and or Public Health England, and those contact details are freely available and easy to get hold of. And of course, they should contact and let the individuals know. They shouldn't wait for NHS Test and Trace. In order to do that, if they become aware that there's a potential problem, then the immediate need is to identify the people who've had close contact with the positive case or cases, tell them quickly and advise them not to come in, and then advise them to isolate, bearing in mind the rule changes that are coming on in relation to isolation. But if worried, get a test, get a test done and put your mind at rest.
We're waiting with interest to see what happens mid-August in relation to the rules on self-isolation. So there's clearly a big onus on the employer here, but do I as an individual employee, do I have obligations to my employer about how I'm behaving?
You have obligations to your fellow employees. And it's actually a duty under the Health and Safety at Work Act, which requires an employee to conduct their work activity in a way which considers and ensures, so far as reasonably practicable, that they and anyone else who are affected by what they're doing are not exposed to risk. Breach of that duty is actually a criminal offence. So there is potentially quite a big stick that an employer could use to try to influence or persuade an employee to comply, for example, with the control measures that their risk assessment has generated. Because if they breach that duty, if they don't take steps to ensure their own safety or the safety of others, then that's potentially a criminal offence that they can commit as an individual. And of course, there's a duty on everybody to cooperate with each other and to ensure that they're behaving in the right way. I think the use of the legal duty should be a last resort, because it relates back to the communication piece and the way that employers and employees speak to each other. Everybody's trying to get to the same end point, which is that the workplace is safe and everyone is able to work and feel safe when they're there. So you'd hope that in the vast majority of cases, employers and employees can work together and cooperate with each other in order to achieve the mutual aim.
Absolutely, and I think we'd all agree that is sort of the last step that you would want to take, but it's clearly an issue which may need some very careful handling if, as we return to the workplace, or as the situation develops, that employers need to take advice, because clearly every case is going to be different, every workplace is different. So that's very helpful to understand, though, that there is that ultimate requirement on the employee. You mentioned earlier about the change in rules on self-isolation, and as I say, I think we move forward with some degree of uncertainty. I suspect that actually those rules may well be changed. So with that in mind, what's the situation where the employer is in a position where they have key workers who potentially can come into the workplace, who don't have to self-isolate?
So I think the current situation is that it remains the case that if you are notified by NHS Test and Trace that you've been in contact or close contact with someone who's tested positive, it remains the case that by law you must self-isolate, regardless of your vaccination status, and to fail to do that remains a criminal offence. The proposal from mid-August, as I understand it, is that if you're fully vaccinated, you'll be exempt from the requirement to self-isolate if you've been in touch with somebody who's tested positive, but the advice is that you should take a PCR test yourself as soon as possible. There's also, there has been and continues to be a lot of debate about those who are under 18, I think impacted by the huge impact there's been, particularly in the latter half of the summer term, on schools and people being youngsters being out of school. The proposal, I think, for under 18s is that that they'll be exempt from having to self-isolate after a contact. But as with adults, the advice is that there'll be some advice about whether a PCR test is needed. If you're 18, as I understand it, you'll be treated in the same way as the under 18s for 4 months after your 18th birthday, and that's to give you the opportunity to go and get your jabs and get vaccinated. Of course, then if you do test positive, you'll need to do the self-isolation regardless of your vaccination status or your age.
I've seen lots of discussion about key workers and the impact of self-isolation on employers' ability to continue production, to continue with the delivery of service, in hospitality and manufacturing, and that's been a very high-profile discussion. In terms of that whole situation around key workers, are there any health and safety specific issues around the vaccination declaration?
Yeah, so this is an area, as we've discussed between ourselves, where it becomes a grey area between health and safety law and various other employment law, but also data protection law. And from a health and safety perspective, the duty is the straightforward one that I mentioned at the beginning. The duty remains to ensure, as far as reasonably practical, that people are not exposed to risk. But the question about whether someone's vaccinated or not is an important part of the risk assessment that we've been talking about, and there's particularly the person-specific element of that risk assessment. If you've got somebody who is prepared to tell you that they're vaccinated, your risk assessment might reach a different output than if somebody refuses to tell you that. And it's also relevant, of course, because those individuals might themselves be coming into contact with somebody who's themselves vulnerable for an unrelated reason. So it's an important part of the risk assessment and the control measures from a health and safety perspective. But you're, I think, better qualified than me to talk about the employment aspects and perhaps the data aspect.
Yes, and certainly we know from talking to clients there are issues around identifying your lawful basis for processing if you ask for that information. Clearly got to be in the employer's legitimate interests to ensure that people are fully vaccinated. I think one of the issues that we are likely to see is a situation where there's a challenge about whether requiring or requesting that information actually of itself amounts to a lawful order or lawful request, and whether disciplinary action may well follow. All of that obviously needs to be examined in detail. As with all of these things, everything is very, very fact specific, but we are expecting there to be a degree of concern from employers on this particular issue. And at the time of recording this, we've just been advised that the government itself won't be producing a list of key workers. It's going to be for organisations to actually apply for that status. So even greater uncertainty, I suspect, for employers. But it's good to hear that fundamentally the risk assessment is absolutely central, and this is a bolt-on, if you like, to all the existing obligations the employer has. So I just want to thank you for all your really valuable insight, Andrew. If those listening have particular health and safety queries, Andrew is the person to contact. He and his team would be very happy to help you. If you have focused questions relating to employee issues, then it's our team, and anything relating to data protection, that will be Jocelyn Pauly and her team. But we're all here to help you deal with any issues that you have.
Thank you for listening to this Gowling WLG podcast. If you liked this episode, please be sure to check out our website, gowlingwlg.com, for more useful podcasts and articles, or please leave us a review on iTunes. Make sure you subscribe to the podcast to join us for our next episode.